panélistes d'État, je voudrais vous présenter mes respects, Monsieur le professeur Tidiane, co-président de cette session, Mesdames et Messieurs les membres du
I would like to,
Mesdames et Messieurs, chers panélistes,
ladies and gentlemen, members of the scientific committee, members of the panel, dear participants, I'm indeed very happy to take part in this Galien Africa Forum, a meeting which has indeed become part of Africa's agenda in this area. I would like to express my apologies to the Minister of Health and Social Action, Professor. We are very happy to have you amongst us, and I would like to express satisfaction with the fact that the forum is presided over by the President of the Republic of Senegal. The health crisis, the current health crisis linked to COVID-19 has indeed guided the theme for this forum. It led to the choice of that theme for our meeting. The COVID-19 pandemic, which is affecting the entire world for close to a year, has indeed consequences on the social, economic, and cultural and scientific spheres of our country. In Africa, no country was spared, even though the continent did not have as many cases as some anticipated. There are questions which come up. Are we very ready? What has been the level of mobilization of the stakeholders, the community stakeholders? Traditional medicine, which is very present in the continent, has it really played any role in the fight against the pandemic? What is the role of the community in this fight to ensure that drugs are placed at the disposal of people in all the different parts of the country? These are the different themes which we are going to deal with in this panel, that is multisectoral participation, the strengths and weaknesses of recommendations, the contribution of traditional medicine in the fight against the COVID-19 pandemic, the current situation, the prospects, the provision of drugs in Africa, and challenges and perspectives. These are the different themes which we will be dealing with, and in all, we'll have two members of the panel who would speak successively, and they will each be given 5 minutes. To start, they'll have to share their experiences on this subject. And there's also a former patient who, a former minister of Senegal, who also had the virus and who is today cured, will testify during this session. We'll be told how he experienced the illness. There will be other speakers, of course, and after their communication, we'll hold discussions for 30 minutes. And I am indeed pleased to be the moderator for this session with Professor. Now, let me introduce the first speaker, Madam Yacine Diop, who is the Executive Director of Speak of Africa. Madam, please, you have the floor. Thank you, Chair, and good afternoon to you all. It is indeed a pleasure for me to be here today and to share my experiences in relation to this COVID-19 pandemic. And this is a multi-sectoral participation.
Justement, s'assurer qu'on a les financements nécessaires en place, les bonnes politiques, mais aussi de pouvoir rassembler toutes les parties prenantes autour des différentes
The
thématiques.
interpreter has problems hearing the speaker, notably in the field of health and sensitization. So we're working in a very friendly environment, which makes it possible for us to do our job appropriately. We have gone to different parts of the countryside, and we try to work with partners. And in particular, in Senegal, as some years ago, we saw this type of commitment within the framework in the fight against malaria. And we try to ensure that everybody could be put on board in the fight against the pandemic. There are three pillars: the public, private sector, and the communal level. And today, this campaign is indeed launched in 7 countries across the African continent, and it is indeed a campaign which started in 1 country at the communal level and which has spread to other parts of the continent. When we look at the success of this campaign, we notice that it is indeed there's a strong commitment of the political leaders and at the communal level, and we have champions like Diop and others who he lost his daughter to malaria, and today he works in that fight. So in response to the COVID-19 pandemic in Africa, we've been able to start a campaign, remain careful with different partners, including the African Football Confederation and Special Olympics. And
comment est-ce qu'on pouvait combattre la mésinformation, mais également pouvoir...
We work with them at the national level, and we provide training. And within the framework of this campaign, we have come up with several initiatives, notably an initiative which consists in setting up hand washing machines in schools in Senegal, but also to focus on platforms at the level of the African Football Confederation to use footballers to spread the message to all the population, and that is in a bit to make them have the information. And we talk to them about the behavior to adopt. We work with those different partners, and we try to see which policies should be adopted. We think of the needs for funding, and how we can work together to indeed respond effectively to the pandemic.
Pouvoir mettre à disposition cette plateforme qui permet justement de le faire. Et peut-être juste un dernier point par rapport aux différents...
We have slightly speaker with network problems, but we are trying to train participants. We had the opportunity during the pre-forum of the youth to start to launch a new prize for new African innovators on health. And we did so in partnership with ISHMA. And we believe that through this prize, we could encourage innovation amongst the youth. And we could see how we could work with our young scientists to find solutions to this problem which we face today and to improve treatment. In a nutshell, that is what I wanted to share with you in regard to our treatment within the framework of this pandemic COVID-19, and I hope that this will come to an end very quickly. Thank you. Thank you very much, Madam Kibo. And now it is my turn to introduce the next speaker, and I'd like to pay tribute to Madam Minister of State, and I would like to congratulate her for the Galien Forum. But there were earlier speakers like the group of women and all those who have participated. Now it is indeed an honor and pleasure for me to introduce one of the great anthropologist and sociologist in the health field in Africa, Professor Cheikh Ibrahima NIANG, with whom I've had the opportunity to work on several occasions, to work on HIV/AIDS and also in the social context. This professor, sociologist, anthropologist, is well known not only in Africa but all over the world, Senegal and other African countries. You have helped them in the fight against COVID-19. Can you share with us the strengths and weaknesses, and especially your recommendations for the future? If possible, can you do all of that in 5 minutes? Professor, you have the floor, and thank you very much. Unmute your microphone, sir. Kindly unmute your microphone, Professor. If Professor Niang is not online, but we can see him, Yes, he is online, we can see him. Can you hear me? Yes, I can hear you. Can you hear me? Thank you very much. Thank you very much. And thank you for these kind words towards me. Well, my real constraint now will be time. As you must be aware, I'm really talkative. But I'll try to speak to one of the main axes, which I think is philosophical. There is really no epidemic in the world which can be solved without involving, without the participation, without awareness of the population. It is declared in the community and it has to be dealt with by the community. So if there is resistance, if the community does not really work in the fight against the pandemic, then there will be no response to the pandemic. Now, how has Africa succeeded with very good results in spite of its problems? I think this is not an accident. I'm talking about the principle that there was indeed communal response in Africa. There was communal commitment. There was communal resilience. And there are billions of micro processes which can be explained. So, given that there was increased resistance, we must know that this leads to vulnerability for communities. And it also weakens the communities. This is to say, why did we not have so much resistance in Africa, and the Africans decided to go in and to produce solutions to this problem? Let me try to summarize everything. Indeed, there was something before COVID. Before COVID, the WHO Afro made a considerable contribution by preparing communication at the communal level. Works were carried out, training, capacity building was conducted involving different services, and it was a multisectoral approach. And this multisectoral approach in the framework of the preparation of a response in emergency situation is already known to Africans. So what did Africa do specifically which led to the fact that this multisectoral approach was successful more than in other continents? It is the contextualization of this multisectoral approach by invoking the cultural dimension, the anthropological dimension, which also is the fact that there was also the fight of this, the fight against this pandemic, which consisted in the relationship, the gender relationship, because women are at the center in the fight against diseases. So the response became strengthened in the society thanks to the contribution of women, and as well as the cultural resources and the local conception in the fight against the pandemic. So what came before Corona in matters of communication, in communal communication, must be explained. And secondly, the communal dynamism and the communal responses in emergency situations, because when the first cases of communal transmission, when the first cases were identified in Senegal, it was sociologists, anthropologists, and social scientists, researchers who
combler le gap des réponses institutionnelles au niveau de la ville de Touba. Ceci amène à formuler la recommandation de former, de former et de doter en capacité des équipes mobiles et rapides.
Okay, he says, come back. So this anthropologist indeed acted promptly, and this contributed in the fight against the pandemic. Now, how did the people work? Now, let's begin with their capacity to listen. At times, the society is too authoritative, too paternalistic, and could itself generate resistance or even revolt in the community, because the community feels that they have been affected somehow and their traditions have not been respected. So this work of communication is fundamental in Africa. And I think for this COVID case, those in charge of communication very quickly went into work, and that was extremely important. And this could be considered as one of the achievements. And there, somewhere else, they have to work like and work in an anthill and work round the clock. And finally, at the communal level, how are decisions made? So there are religious aspects which must be taken into consideration. There are associations which must be taken into consideration. Network for women and others in the countryside. How do we listen to them? How do we get in touch with them? And so we came up with a strategy to respond. And that way, all of this became very important in the response. And this gives the response a human face. So this was the case in all the emergency cases at the initial stage. So when the initial cases started, this response was activated, and there was the issue of stigmatization, those who are sick. So there was a need indeed to have empathy towards people who are sick from the cultural perspective, and that is indeed very important to deal with the pandemic. The second aspect, which is also very important, which should be taken into consideration, is information. If there's no information, there will be a problem. There should be continuous information, and traditionally we call it research and action. So this is research, which is traditional, and it tries to articulate very quickly the communal action. And at that level also, there are interesting experiences in Dakar, and we succeeded with a new cartography for those who have to participate in this fight. The stakeholders and local initiatives were taken on board, and there were frameworks to listen for consultation and co-construction at the district level with communal leaders. and all the different networks, including subversive networks, subversive because they question the approach, and they work in complicity with different movements. So we work with all of them to ensure that this will lead to collective decisions. Now, this informative research must be documented. I think you'll have to round up. Yes, I'm going to round up. And lastly, this Senegalese experience shows the birth of a new source of information, that is traditional, classical information, where you have several sources which come together to constitute a source of information. At times, people say the community already knows. So how could we channel this information through more active information and go beyond what the community already knows, so that they'll be able to acquire information? So we could have daily information. We were able to train more than 100 students as volunteers, 1,200 trainers in districts were trained, and over 12,000 volunteers in different districts were trained. They come to listen, they construct, and they follow the responses which are given at the level of communities, because the battle is indeed at the level of the communities. Now, let's look at the weaknesses and the current situation. What can we recommend? I don't know. Perhaps there's a link between ecology and this pandemic, but I want to notice that during the cold seasons, this pandemic is greater, and so it leads to a change in behavior. This change in behavior could indeed constitute areas of vulnerability. So what should we do in regard to change of behavior related to change of climate? Now, the entire situation, what do we do indoors? What do we do in homes? What do we do in our rooms? What do we do in the parlors when we watch TV? To spend time, because it is not possible to go out. So what is the culture which indeed develops during this pandemic? There are some responses which we can identify and which could be translated precisely and which you could benefit from. Now, looking at the cultural ecological aspect, that's internal ecology. In this relationship, this cultural ecological relationship, there's also the woman, for instance, some who are the custodians of health and behaviors in the society. The times are changing. So what should we do? What tools could we use to ensure that women can take leadership in the fight against this second wave? Because this second wave is indeed very serious, be it in the United States or anywhere else in the world or in Africa. It is indeed a serious case, because many other countries could indeed face the risk. And especially, we have learned that the health structures themselves could indeed lead to stigmatization. So how can we introduce philosophical, conceptual changes and structural changes to reduce stigmatization in the health system, to develop empathy, recognition of the other, and equality, because these are all African concepts which are very important here. So we should be able to respect the dignity of the others, and it is part of health. And so when we explain dignity in terms of health, this will enable us to face the situation in health centers and in other parts of the community, because there are too many cases. So in relation to all that, what can we do at home in regard to treatment and care? How can we prepare? There should be social and cultural preparation, and the experience of Senegal could indeed enable us to draw some lessons and which could be updated. So the major problem which we'll face is that of the vaccines. The vaccines could also be a cultural object. So if the vaccine has to face a culture, it has to face a history and a heritage. We are in a situation of dangerous political context. And there's an adage which says that when two elephants fight, it's the grass that will suffer. So when the political context is bleak, when there is no danger of policies to be accepted, then social science research will be affected and the credibility of communal engagement will be questioned. So what can we do at that level? We should be able to listen more. We should be able to promote the sacerdoce concept, the religious concept at the political level. Because I'm rounding up, and at the political and economic levels, to some it is considered as business. So there's a fight against corona business, and the fight against corona business will indeed affect the possibility of a response. And then all the recommendations concerning transparency in management, community control, and continuity, because it is the participation of the state in communal activity that should constitute the leadership. In a nutshell, that is what I wanted to share with you, and I'm at your disposal for any questions. And thank you very much. Thank you. Thank you very much, Professor. It is indeed interesting, but unfortunately, time was not on our side and we have to manage it. Now, I'm going to introduce Professor Francis OMASWA. Professor, you are the Executive Director of STAN Africa for the World Health, and you are also the winner of the NOGUCHI Prize for 2019. I want to congratulate you for being winning that distinction. Professor, what was the role of your institution in Uganda in strengthening the multisectoral participation in the fight against the COVID-19 pandemic? Professor, you have the floor.
Good. There's a lot of rain here and may affect the audibility of my presentation. It's a pleasure to meet up with old colleagues, Peter PIOT, and also Cheikh, Ibrahima there. I know him from previous meetings. And I'm going to share with you briefly our experience here in Uganda with respect to the role of community engagement in our COVID response. Well, I will share with you a bit about health. This is for the population, not you people. You are already familiar with this, but I will spend most of the time in describing our strategy here in Uganda and conclude by suggesting what we in Africa can do as lessons from this experience in Uganda. So this message is familiar. You know, health, definition of the Constitution of WHO, the Universal Declaration on Human Rights. It is not about illness alone. It is about well-being. It's about social welfare. It's about security. It's about peace of mind. So that message, I don't need to spend much time with you. And then this is the message here on which our strategy is based, comes from Alma Ata. Basically, the people must be empowered. They must be encouraged. They must be supported to play a role as a duty as well as a right to create their health with the resources that they have at the material time. And this is a quotation many years ago. Peter PIOT knows I was the Director General of Health Services in the Ministry of Health, and this statement played on the radio many times a day for 5 or 6 years, that health is made at home and only repaired in health facilities after it has broken down. People should be hygiene, nutrition, and making sure that their homes are neat and clean. So this is the message of community engagement, the role of communities. So this is a very important background message. Most of us are born healthy, and the French physiologist Claude Bernard told us about the internal environment, which really is very well regulated, so that if you obey your body, you should be able to live without needing health care for very extended periods of time. And this message needs to get to the population, needs to get to everyone, and it is the foundation of SDG 3. But there has to be a partnership between individuals, their health systems, and their governments. Individuals with the primary responsibility for maintaining their own health, that of their families and people they care for, the health system giving them knowledge which they need, and laws which enable people to behave right, government ensuring there is safe food, clean water, housing, law and order, so that people can get around their jobs. But remember that it starts with the individual having personal responsibility for their health. So to me, engagement of communities is what we are, something we are pretending. We know that it's important, but we are doing nothing about it, or we are not doing enough about it. And we are lecturing to the populations, COVID, wash hands, social distancing, and so on. But we are not asking the people their own views about the challenges that they face. Where do they get the water from for washing hands? And the soap, the struggles they have with the stigma, and so on. The people are being lectured to, they are being told what to do, but they are not being asked what they can do about it themselves. All those issues now which have emerged, I think the whole of Africa is seeing this with lockdown, teenage pregnancies, gender-based violence, and so on. So this message is important. We need to engage the people, not to lecture to them about things which they can handle themselves. So again, no one argues about this. The African Union Health Strategy, it calls for vibrant ways of living in communities and so on. Dr. Tedros is always saying, people-centered is the way for universal health coverage. This is a friend of mine, the third bullet there, Professor Miriam Were from Kenya. She says that if health development does not happen in African communities, it will not happen in African nations. And you can find this statement in a book we have written, I edited with Lord Nigel Crisp, called African Leaders Making Change and Claiming the Future, chapter 8. So all this is okay, no one disagrees with it, but we are not doing enough about this, and that is the problem, and that is what we are going to talk about. So here is Uganda with COVID. We are now in phase 4. This COVID is in the communities. We are not testing enough. We don't know enough about the state of the problem here, but we know that it's there because prominent people are contracting COVID and they are dying from it. We know that our health facilities are very stressed because of handling COVID patients. The solution, therefore, is to hand responsibility to the people so that they can handle the prevention and care themselves. So that strategy has been promulgated, directed by the President of Uganda himself, and these are the elements, the key elements of this strategy. So the key objective, to make all the people in Uganda aware, make them empowered, and they are participating themselves in the control of COVID-19 as a duty, as a right, but above all, using the existing systems, governance systems, and the resources that they have, because there is no time to wait. Then it's also the guiding principle is that empowering individuals and communities, good health starts with people. I've made this point already. I will not dwell so much more on it. And it's only supported where necessary by the health professional skills and equipment. But the primary responsibility remains with individuals and communities. And our strategy here is to use existing systems, existing structures. I will show them to you in a moment, which should be able to help people reduce infections or identify infections properly, early, send for testing, rehabilitate those who come back after they have recovered from the disease outside their communities. And we are recommending intersectoral collaboration, the whole of society approach. As you'll see in a moment, that the structures we are creating are intersectoral, because this epidemics occur where people and how people live. So we bring in all key players of government, and it is going to end up with a strong people-centered primary health care, long beyond COVID, with huge financial and economic returns for the health system here, if it works. So that is the link between the community engagement structure and the governance system in Uganda. At the very bottom there is a structure called local council. Every village has a committee chaired by a chairperson whom they elect themselves, and a committee of 9 people, a secretary for women and children, secretary for security, a secretary for production, agriculture, and so on. So there, they are what is called village health teams, which are basically community health workers who are in the community. Up to now, they have been volunteers. They get allowances from time to time when there is an immunization campaign and so on. Then we have, these are the duties and the structures which we have included in our strategy. Every village will have a COVID task force, and it is led by the political leader of the village. It has got those individuals whom I have told you about, including other sectors, community development, religious leaders, cultural leaders, representatives of the schools, if the school is there, and health facilities, and also civil society organizations and the private sector. And their role is to undertake community-based surveillance and case detection, community case management, contact tracing, shielding the vulnerable, and above all, maintaining a village health register. These people visit 5 to 10 homes every day, and they keep a record. You know, the head of this home is called OMASWA. Does he have high blood pressure? Is he diabetic? What are his vulnerabilities? His wife is so and so. Is she attending family planning? Is she pregnant? Where is she going to deliver? So all that are kept in a register by the community health worker in the village, who is receiving facilitation allowance from the government to do that work. They get about, I think, $30, equivalent of $30 US. This came about because already before COVID, my organization, and Peter PIOT knows about ACHEST, we started studies in 7 African countries on intersectoral collaboration for SDGs. And then we found that it is the key to achieving SDGs, which are interlocked. So we started a model in one of the districts called Ngora, and there now, all those things which I have...
Accélérer, allez vite.
Oh, yeah, it's almost finished, another 5 minutes. So we have...
please, because, yeah, okay, go ahead, please, Francis.
Yeah, so this, what I've told you, is happening in the villages here. Now the utilization of health facilities is shot up so high. And so, and I think these are the results here. You can see for yourself. A year ago, September last year, and September now. The September now is in red. You can see how much better they have performed just because of this intervention alone. And these are the outcomes which we expect: mobilized communities, taking charge, and this whole of society approach. It also deals with conflicts in the village. If there is conflict over land or property or other issues, these same people are the ones who deal with them. So it introduces stability. One of the villages has called their program Peace. And what about Africa? What does this mean for Africa? To me, the single most important thing we should do now to achieve SDGs on time is to engage communities and empower communities and introduce people-centered, integrated people-centered community health services. Not just community health workers, but community health services which are owned and led by all of society, including government leaders. And of course, through intersectoral communication, empower the people. That will also increase the demand, and also set standards for each level of the health system, use data, above all, strengthen leadership and governance of our health systems and human resources for health. We know all this. The problem is we are not doing it. There is a sense of urgency. The crisis of COVID is real. And my message is to inspire each one of us, wherever we are, to get on and do something in person. Here in Uganda, I'm the chair of the community engagement strategy of the National COVID Task Force. And that is my contribution. Thank you for listening to me.
Thank you so much, Francis, for sharing your very rich experience. Congratulations again for the NOGUCHI award. I'm sorry I couldn't be there because of the circumstances last year. I think the next speaker will kind of try to implement what you're saying. And so thank you again.
Bon, l'orateur suivant.
The next speaker is the very explanation of what the Professor NIANG has said already. It is the commitment of people that have lived with COVID-19 is very, very important. The engagement is very important. As many participants, I am here to I live in a country where there is a lot of HIV patients, and they have a very important role. And so I would like, this is the former Minister of Culture of Senegal that have suffered from COVID-19, as myself, actually. I have needed months to actually feel back like myself. Your evolution was favorable after being hospitalized in intensive care for more than 3 weeks. Can you share with us your experience, and what are the recommendations that you can make towards decision makers, the population, and also for vulnerable patients? In 5 minutes, if possible, really. Thank you. You have the floor.
Monsieur le ministre, votre micro est fermé.
Mr. the Minister, your microphone is muted. Could you please turn it on?
Bonjour.
Good morning. Can you hear me? Yes, yes, we can hear you. Thank you very much. I am really sorry. So, good morning, all. I would like to, first of all, commend the Professor Awameko Sek, Ibrahima Sek, who have made me participate to such a session with such eminent people. I will try to not be shy, to overcome my shyness, to talk about my experience as a COVID-19 patient. First of all, the first thing that I would like to tell you is that it sometimes happens to you when you least expect it. I was the people that did not really believe about, that was quite skeptical about the disease. I had taken my precaution. I would wear my mask and wash my hands often. But one day I was in a family ceremony, and this is where I contracted the virus that was confirmed by 3 other cases in the same family, in the same circumstances. My experience with COVID-19, I was detected because I fainted twice in a row, and following these, I was first sent to a cardiologist to look at the reason why I was fainting. First of all, I thought I had a arrhythmia, and since I already fainted twice, we wanted to avoid a third one that could have been fatal for me. So they decided to give me a pacemaker. It is before the analysis that the radiolog saw something in my lungs, and he was quite worried about it. So I was tested for COVID, and I was positive. After that, I went from being a normal patient to becoming an exceptional patient. I was in the hospital Aristide Dantec of Dakar, and it is for me the opportunity to commend the professionalism of the whole medical chain of Senegal. They have been very quick in their response, but also very committed and creative and innovative. And it was really multisectoral because I have diabetes, I am 64 years old, I have other heart diseases, and I do not really exercise much. Well, at least I didn't exercise much, but I've changed now. And so I was what they called a risk patient and a vulnerable patient. So when I was in the Aristide Dantec hospital, where I was in perfect condition, I'd say, I was taken care of by the center and treatment started right away. But it is when the treatment started that I realized that I was actually sick, you know? It is at that very moment that my lungs, I think, were affected, and that my respiratory distress led me to some form of asphyxia for 2 to 3 days. It is thanks to the help of the doctors and their quick reaction that I was able to come back. But for some days, I was in a very, very severe and dire state up until I needed help breathing, because they had to take care of me as a COVID patient, but also of my diabetes medication, because my diabetes was unbalanced because I was taking too much corticoid, and all of it was also accompanied by a loss of weight. So they had to balance everything. So myself, as I said, I have diabetes. I had problems with my lungs, heart disease, and then I ended up with kinesiotherapy, because after all these treatments, I had to learn how to talk again. So I needed physical therapy. I had issues talking, issues walking. I had to learn how to walk again as well, and even how to breathe again. And this period period where I had to come back, I was back at home because I was declared negative, but I couldn't go, for example, during my recovery period to go from my room to the toilet because I had difficulties walking. So what I can say is that this disease is very real. When I said at the beginning that I was skeptical, I was saying, oh, it's been made in China to really make us fierce, but it is a real disease that actually hurts you, and if it's not taken care of early, then it can lead to fatal issues, to fatal consequences. So you have to be aware of that. The other message that I want is that this was a collective error, communication error that the political authorities had at the beginning of the pandemic, at the international but also at the national level. We played on the fear of people, but fear has its limit, and at a certain time it becomes bravery at such a level that people thought that at this point, since there are no solution, we may as well die of something, so let's just keep living. And it is this distortion in communication, in my opinion, that we need to correct so that the population can understand that it is not just about making them fear the disease, but it is important that they can understand the severity of the pandemic. I think the Professor Nyon has said it in his intervention already. There are some political, financial issues that the people do not understand and can interpret in a wrong way. So there is a strategy to put into place to say that there is a cost. Everything has a cost, and life has no cost though. So people need to understand better the different world mechanism and to better accept to pay the price to live a better life. The lesson that myself I've learned from it is that we need to have a healthier life. We need to understand that, for example, I'm 64 years old and I had to change my lifestyle. I exercise more. I eat healthier by favoring nutrients full food, more healthy food, by favoring quality over quantity, by having long walks, and by having a better vision of life, perspective of life. I give more love to my family because now I realize how important family is. Because during this COVID-19 moments, everyone is running away from you. You realize that you have less friends that you thought because of stigmatization. Everyone, one way or another, is just, withdrawing from you, and it is your family that is next to you that encourage you and that is ready to share everything with you. This is my experience. I didn't want to take too much time, so thank you. Thank you very much to you, former minister, for this testimony. I would like to really commend you for this. Thank you as well for the recommendations that you have made. Very useful recommendation. They have been noted down, but also for the messages that you've given to the population and the communities so that they can protect themselves. So this is the last intervention, this fourth intervention rather, excuse me, that is going to put an end to our first theme on multisectoral and community participation, strength, weakness, and recommendation. We can now look into the second theme on contribution of traditional medicine in the response against COVID-19, state of play, challenges, and prospects. We have three professors here that will intervene. I'll start with the Professor Rokia Sanogo, head of the Traditional Medicine Department of the National Institute of Public Health of Mali, and Vice President of the Advisory Committee on Traditional Medicine for the WHO. Professor, could you please look at the improvement of traditional medicine in prevention in the context of COVID-19? Please, in 5 minutes. Professor, you have the floor. Thank you very much. I would like to thank you for this question, and I would like to thank the team of the Galien Forum Africa to have associated me to this session, and I would like to really congratulate the Professor Awako Sek and the Professor Emmanuel Bassen, my master, with whom I will intervene in this session, and the Professor Alain as well. As the Vice President of the Committee Expert of the WHO for Traditional Medicine in the response against COVID-19, I was very happy to listen to Professor Nyang that was saying that we need to listen to communities, and I believe that it is very important to listen to our communities. This will bring us elements of traditional medicine. And it is in this, within this framework, that I would like to commend the setting up of this committee of experts at the WHO, and it was the opportunity to really create a link between what is happening on the ground and the WHO, because there are many experiences from our countries that are not really made visible. So when this committee was set up, the first activities that were carried out were to take a look at the different studies that were ongoing on traditional medicine, to adopt a roadmap, and also to adopt a different protocol that will allow us to assess the efficiency, the safety, and the quality of the product from Pharmacopoeia. Then there was a sharing of experience with the different countries, the approach that the countries have used to use a certain number of products and preparation from the pharmacopoeia that are already used in the fight against viral diseases. So this is how we saw a mobilization, community mobilization of the different practitioners of the centers, with collaboration with the traditional medicine centers, the Department of Traditional Medicine, and universities. This is how we were able to have a database of plants that have antiviral properties and that can intervene in reducing certain symptoms associated with COVID-19.
Les inflammations, mais également l'atout, les difficultés respiratoires.
Difficulties in breathing, and that is how a number of
qu'on appelle médicaments traditionnels
drugs,
améliorés ont été
which we
mis
call
au point
traditional medicine, have been developed to be submitted for investigation. That is how throughout Africa today, the WHO has Secretary of the WHO has identified that there are clinical tests, phase 1 And
à
phase
travers
2,
l'Afrique et aussi des études
across
d'observation.
Africa,
8
and
pays
observation
en Afrique
studies.
aujourd'hui sont
8
en train de
African
faire
countries
des essais
today
cliniques de
are
phase
carrying out
1
clinical
sur
tests,
des
phase
produits issus
1,
de la pharmacopée.
on
2
products
sont en train
from
de faire
African
des
pharmacopoeia.
essais d'observation et 8
2
sont en train de mener des essais
while
de phase
8
2.
are
On ne va pas rentrer dans les
on
détails,
phase 2
mais
clinical trials.
l'OMS
We'll
a
get
fait
into
un
the
répertoire
details,
des travaux
but
qui
the
sont en cours en
WHO
la
has indeed
matière.
come up with a list of work
Et
which
donc,
is ongoing
pour cela,
in traditional
maintenant,
medicine in Africa.
au début de la COVID, tout le monde a écouté
All of this,
certainement l'expérience de ces
people have
patients qui ont
heard
eu un résultat
about the
positif
experience
avec un
of this
produit
patient who had a
qu'on
positive
appelle
result
apivirine
with a
et
product called
qui a
apivirine.
été fait au niveau, qui est fait au
And,
niveau du Bénin, déjà
This
utilisé
was
dans la
produced
prise
in
en charge
Benin
du
Republic
VIH.
and is already being
Et
used in the treatment
il y
of
a eu un certain nombre de
HIV.
protocoles dans l'Afrique
And
de
there
l'Ouest
is
pour
a number of
essayer
protocols
de
in West
voir
Africa
l'étude de cela.
to try
Au niveau du
to
Mali,
see
par
how that
exemple,
can be
nous
used.
avons
In Mali, for
proposé,
instance,
et on a
we
proposé
proposed
des tisanes qui sont déjà utilisées dans l'hépatite virale
roots
et
which are already being
tisanes
used
qui
in the rural
réclament des
areas
vertus thérapeutiques
as
pour
tea
les
and which
propriétés
have
antivirales déjà
medicinal
validées
powers
sur
and
l'hépatite,
which
le
have been
renforcement du
validated in their
système
past
immunitaire,
against
une
viral
tisane qui a
infections.
les propriétés
And these
antitussives,
roots have
bronchodilatatrices,
power to cure cough,
anti-inflammatoires et antioxydantes.
inflammations,
Également,
and
au niveau du Mali, nous avons
very
mis
good
à la
oxidants.
disposition des
In
centres
Mali, we put
de
at the
prise en charge
disposal of
de la
women
COVID
who are treating
un
COVID-19
sirop qu'on appelle le sirop Balembo,
a
qui est issu
syrup.
de la
It is
pharmacopée
called
que
a
nous avons
syrup, and it's also
proposée
from
pour la
traditional
prise en charge de la toux
treatment
sèche
for
associée à
the
la
treatment of
COVID.
dry cough, which
Donc,
is
quand on
associated to
regarde avec
COVID-19.
le meeting que
So,
le comité a eu à
we
faire en
look at the
octobre,
meeting which
nous
this
trouvons qu'il
committee
y a un
held in
certain
October.
nombre de
We
résultats
find that
encourageants
there are a number
pour
of
les
encouraging
premiers
results
essais.
for
Et
the
l'OMS,
first tests which have been
dans
made,
le
and the
cadre du comité,
WHO,
est en
within
train
the
de
framework of the
préparer pour faire
committee,
des essais
is
multicentriques
preparing
avec des
to carry
produits,
out
un certain nombre de
further
produits, dont le produit organique, mais
research
également
on
d'autres
a
produits.
number of
Donc,
products,
ici,
but also products
moi,
for
je
cough as
voulais
well as
dire qu'il est
COVID-19.
important
So I would want to say
de
that it is
tenir
very
compte des
important
deux aspects.
to be aware of the two aspects.
Le niveau communication des praticiens pour la sensibilisation,
The role
l'information
of
et
traditional
l'orientation,
healers,
mais
information
également
and guidelines,
l'offre
but
de soins,
also
des tisanes qui sont
the treatment through
proposées.
these
Il y a beaucoup
routes
de
which are
patients
proposed.
COVID qui ne vont pas dans nos
There
centres
are
de santé parce que vous
many
avez parlé au
COVID
début de la
patients who do not go to
stigmatisation.
our health centers
Donc, il s'agit
because you
pour nous
talked at the beginning
aujourd'hui
of
de faire en
stigmatization.
sorte
So
qu'on
today,
puisse
we should
documenter
ensure
le
that we
recours
should
des
produce
populations aux tisanes,
documents
aux préparations
and
issues de
treat
la
our
pharmacopée. Donc, en
patients
perspective,
with traditional treatment from some of these routes. And in
nous
terms of
pensons,
prospects,
et également
we
un
believe
autre élément de réflexion que nous
that there's
devons faire,
another area for
en quoi
reflection.
la pharmacopée et la
That
médecine
is, how
traditionnelle,
can
en quoi les
traditional
tisanes
treatment and
proposées par les
pharmacopoeia and
tradipraticiens
these routes
ou de
produced by
l'expérience même des
traditional healers
populations, en quoi ces tisanes
or from
ont
the
contribué
experience of
à limiter
the
la
population, how has
propagation
it
au sein
contributed in
communautaire.
limiting
Ça, c'est un
the
point sur lequel nous
propagation of this
devons
COVID-19 within the
discuter.
community?
En
That is
perspective,
an issue which
moi,
should
je
be
crois qu'il
discussed.
est
So in terms
important
of prospects,
aujourd'hui
I believe that it is important today
d'allouer des fonds spécifiques aux institutions de
affect
recherche et aux
funds
centres
for
qui
research
travaillent sur la médecine traditionnelle
for those who are
pour
working in
renforcer
the area of
la
traditional
recherche
treatment
et
to
le
strengthen
développement
research and
pour
development,
valider l'utilisation
to
des
validate
tisanes
the
ou de
use
d'autres
of
formes
these
d'utilisation
routes or other
pour compléter
forms
les
of use
investigations qui sont en
to
cours
complete the
en
investigations
termes
which
de
are ongoing.
recommandations.
In
Nous
terms of
pensons aujourd'hui
recommendations, we
que
believe that today
cette pandémie
this
est une
pandemic
opportunité
is
que
indeed
nous
an
devons
opportunity
vaincre. Mais
which
pour vaincre cela,
we
il va
should
falloir que
defeat. But to
l'Afrique
defeat
puise
this
dans ses
pandemic,
ressources.
Africa will
Parce
need
que la pharmacopée et la
to
médecine
work together
traditionnelle
because
fait
traditional
partie
medicine
du
and
patrimoine
pharmacopoeia are
africain.
part of the
Moi, j'ai dit, le
African
professeur
heritage,
Yang a dit
and
également,
I
les
said it, and
réponses
Professor Inyang
culturelles
also said it.
et la
Cultural
médecine
responses could indeed
traditionnelle
lead
est
to a
notre
solution.
patrimoine
Traditional
culturel
medicine is
et
our
je crois que nous devons y
heritage,
faire
and I
recours
believe that we
pour
have to
la
make
santé
recourse to it
et pour
for health
l'avenir,
issues
Parce
and
que nous
for
devons
the
faire en
future,
sorte que
because
désormais,
we have to ensure
l'Afrique
that
institue des
henceforth
programmes durables, pas
Africa should
circonstanciels,
institute
pas
sustainable
événementiels,
programs,
des
not just
programmes
events.
durables.
There
Et
should be
je crois que
sustainable programs, and I
l'OMASWA
believe that the
et
WHO,
l'Union africaine,
the
avec la
African
mise en place
Union,
de ce comité,
and the setting up
pourront
of this
instituer ces
committee
programmes
will be
durables.
able
Et
to
je crois que
institute
le
this on a
forum Galien
sustainable
Afrique,
basis.
qui a
And the forum
institué de
Galien
parler
Afrique,
de la médecine traditionnelle de la
which
pharmacopée,
talks about
ensemble,
traditional
je crois
medicine
que
and
nous pourrons
pharmacopoeia, I believe that together
instituer
we'll be
cela
able
pour
to
que les
work
ressources de
together
la
to solve
pharmacopée et la
the
médecine
problem.
traditionnelle puissent
So
contribuer
pharmacopoeia
à
and
lutter
traditional
contre
medicine could
les
indeed
maladies
contribute
émergentes et
in the fight
réémergentes,
against
mais que
emerging and
l'Afrique apporte
re-emerging
sa
diseases,
solution
and Africa will be able to come up with
la
its own
couverture, une
solution
couverture sanitaire.
to health coverage in the continent.
C'est ce que je voulais dire.
That
Et
is
aux
what
échanges.
I
Merci.
wanted to say, and thank you very much. Thank you very much, Professor Sanogo, for this different dimension of what we're talking about. Now, I'll give the floor to Professor Basseni, Emmanuel Basseni, who is a holder of a degree in traditional medicine and pharmacopoeia in the Ministry of Health and Social Action in Senegal. So, could you just tell us the contribution of traditional medicine in caring for patients who are infected with the COVID-19 pandemic in Senegal and the challenge which you've been able to face up till now? Thank you very much, Professor, for your contribution. Thank you. It's Professor PIOT. I would first of all express my greetings to all those who are present and the representative of the Minister of Health of Senegal, Mr. Mbeng. After the earlier speakers, let me also participate in the reflection. I would first of all want to say that the African system, especially in West Africa, was more or less ready to face this pandemic because the systems are endowed with structures in communities through preventive services in the Ministry of Health. And this service indeed was motivated and strengthened at the level of the borders and at the communal level. Communities themselves were organized. We have the Bajenogo, and all these systems were indeed prepared to deal with this new pandemic. And of course, as it wasn't a surprise, it was necessary to adapt and to be vigilant to deal with it. I'm going to talk along the same lines as Professor NIANG and Professor OMASWA. I'll say in English. The fear relating to confinement and this state of emergency turned out to be a storm in a teacup. And by making it possible those who have as a heritage can see exactly what was going on. Now, the community, the entire community was already armed to face this pandemic. They had some way of fighting this pandemic. So we believe that Africa is a continent which is believed not to have sufficient medication to deal with the multiple attacks from microbes and viruses. Because you will understand that there's flu in Europe during winter, and all of that we used to have in Africa also. So we can say that that pandemic was already there, and we could say that there was already resistance to that flu because it was already existing in certain parts of our country. So the country was already ready to deal with this flu. In Senegal, there was the issue of mobilization. People were quickly mobilized with traditional healers and communal stakeholders, even in big cities like Bajanogo, which were established in the year 2000. So all of this put together make it possible to quickly spread amongst the people in the community the need for social distancing, restrictions, the wearing of masks. Of course, the masks were expensive from the onset, but people were able to wear their masks, and people limited their movements, they limited the number of meetings which were taking place, and all of this was brought to the knowledge of the community thanks to these traditional healers. I don't want to take much of your time, but the contribution of traditional medicine was done without a lot of noise because we really don't have any information to assess this. And you'll see that the cases which did not go to the hospital were dealt with very quickly by communal action through use of roots and everything that could be used to help our body to defend, our body system to defend itself and to fight against infections. It is indeed a prospect which we are going to talk about. And as some said, we should be systematic. What the WHO recommends may not necessarily be the solution all the time. In other words, we should go back to our roots and try to see how we can rely on our capacities. Of course, we should work with our partners to develop medical plans is in the interest of all. So I do not quite see, for instance, how we could take a timazine or its derivatives and say that that it should be avoided. So the message should be put differently to enable people to better understand the information and believe in the information which is being given to them. So the professor said a while ago, some of these pre-clinics have been used, but they were not very much recognized, and there was no clear policy on the use of medicinal plants and on the use of traditional medicine. So it is important for both of them to be used together because we cannot exclude what researchers in the university are doing, and at the same time, we cannot exclude what is being done at the level of the community in terms of traditional medicine. So that is my message, and this will lead to discussions. Thank you very much. Thank you very much, Professor Bassin, for this presentation. We would like to express satisfaction with what you are doing in the field of traditional medicine in the Ministry of Health and Social Affairs. Now we're going to call on Professor Sakuba, who is a neurologist and a member of the African Committee of Traditional Healers. He's from Madagascar. Professor, now as a neurologist and member of the Africa Regional Group, can you share with us your experience and especially the difficulties which you had to face. It's practically the same question we've put to the others. So please, we await your response, and you have 5 minutes. Professor, you have the floor. Thank you, Chair. Chair, permit me first of all to subscribe to appreciations, thanks, and congratulating all those who spoke before me. That is, all those who have contributed from far or near to the success of this State Galien Forum. Permit me also to respond to your question. Indeed, as a doctor in hospital, of course, in the face of this epidemic, there are measures to be taken because it's a new illness. And when we try to refer to our colleagues, our European colleagues, they don't agree on what should be the best treatment. And when we try to look a little bit further in the Americas, in such a context, we notice that we discovered that we're dealing with one of the greatest pandemics in Madagascar. That is, we decided that we had to deal with COVID. That's organic COVID. This is a local product produced from Artemisia. It was proposed to us by the Ministry of Health in the number of drugs used in the treatment. It is an unknown illness, and there was no known treatment. So we already have the experience of using plant medicine in our country for years now. And we have many medications which are proposed in the treatment of all sorts of illnesses. But we had reference treatment in other countries, which made it possible for us to follow up with what is proposed to us as drugs for local traditional treatment, and which it finally made it possible for us to know what to do where we fail to succeed. So it was important for us to face the situation as it was, because we couldn't find any better solution from anywhere. And that is how the flux of sick people came in, and we tried as much as possible to look from a different perspective of this traditional medicine. And I would like to talk about traditional medicine practice, because in our country, we have learned and we have tried to deal with illnesses through the fight against epidemics, especially COVID-19. Finally, we discovered that the manner in which our traditional healers were dealing with COVID-19 was indeed a source of inspiration for modern therapy in the fight against incurable diseases, because we did not meet any traditional healer who did not practice polytherapy. And today, you know that in medicine, in ultramodern medicine, all that is done when one is dealing with incurable or difficult illnesses to deal with, you don't use polytherapy. So all viral diseases and all the major fights which medicine has won against viruses is through polytherapy. So our traditional healers practice this polytherapy, and they've been doing so since the Ice Age. And therefore, we should try to go a little bit further in this experience. So this polytherapy which they practice also has other competitive advantages in comparison to modern medicine because it is already based to past achievements. So today we can convince people to take these traditional medicines. You can look at the struggle in the production of vaccines today. Now, what are traditional healers doing? They want people to accept their products, and that was the case with COVID here in Madagascar. We saw people queuing up, and we ourselves as doctors in hospital, we had problems with the medication we were proposing to sick people. So this is an achievement of traditional medicine, and these are products which are indeed accepted through scientific practice. The problems faced amongst the population is the fact that the prices are reasonable, because all modern medication are very expensive and just too expensive for us. So we found that research in Africa could indeed contribute in the fight against incurable diseases. Perhaps it is the most accessible means right now, this traditional means of treatment, because we have a lot of very many traditional healers. We have our local experts, and the flora and fauna could be developed. The flora and fauna are available on the entire continent. I would want to say also that if we could indeed develop this into an agro-industrial area, it would be very important for the regional economies of Africa, you can imagine. So it would be an economic sector which could indeed be adapted to our needs and would be adapted to our capacities, and it will also be an investment. So I think of Afro champions, we have universities. Professor Rokia, for instance, has just made an inventory of this, and he has talked about experts who can indeed deal with COVID. I had the opportunity to participate in that meeting, and I now know that we have the necessary laboratories, the capacity to produce, the production units, the capacity to valorize. So Africa has indeed a proper standard. We can valorize and standardize our products. And when it comes to marketing, there's the African Common Market, which has just started. And in short, we can say that perhaps we have to go through these traditional practices and do something for ourselves, not only for COVID-19, because it could be extended to all other illnesses which are considered to be incurable, because the concept of all treatment, as I wanted to say, is polytherapy. And perhaps we should extend this approach to all these other illnesses. I hope that we are all going to abide by this, and that the future commissioners of the African Union, future heads of state, will be champions to promote traditional healing. And WHO Africa should initiate something which could be controlled to deal with these aspirations. And thank you very much for your attention. Thank you very much, Professor. And indeed, it's another perspective for me. For a neurologist, I believe that this could be a real perspective. Thank you very much. Now, we will move to a completely different dimension after these very rich contributions on traditional medicine. And we'll be looking at the supply chain of medication in the fight against COVID-19 in Africa. We'll also look at the challenges and prospects. Dr. Alassane Ba, he's the director of the Center for the Humanitarian Center for Professions in the pharmaceutical field. So there are some European states who have taken it a duty to supply the African market with medication to fight the COVID-19 pandemic. Can you share the actions of your health center and make recommendations to deal with this type of situation in the local production of medication in Africa? If possible, you can do that in 5 minutes. You have the floor. Good afternoon, Professor, and thank you very much. Of course, I am very much, very happy to be part of this panel, but also I'm happy to be able to talk beside my sister and an exec. And so permit me to talk about the impact of these decisions and what should be done and what is being done. And I will just want to talk about the complexity of the health situation which we are working on right now. Why is it complex? Because it is a health product for the public, which and states have to ensure that this product should be accessible to everybody, regardless of where the people are found and regardless of their financial capacity. And it's also an economic product because it's a product which is industrial, and there is a desire, of course, to make profit by the manufacturers, and it's an industrial product, and it needs to be fabricated in huge quantities. So, of course, it's an economic product, and these vaccines, there's quite often there's blackmail, and a country which produces a medication could say, I will not share the medication with you. And so this country which is seeking the medication will be in a position of weakness. So these are some of the weaknesses I'm talking about. So now, when I have to talk about the impact of COVID and what we did and what I think our country should do, now, contrary to what has been said from the onset, we did not have sufficient stocks at the beginning because a country like Benin had to organize to have sufficient stocks of medication. But the first impact was the fact that there were lots of fake drugs. We had a lot of fake drugs, and the impact was that we have problems hearing the speaker. There are slight interruptions, but we'll try to follow. So as a matter of fact, it was important to try to assess the needs and assess the stock. And as you are aware, we have to ensure that the quality was appropriate. And this was indeed the impact of COVID-19. So what did we do? And that could be interesting too. The very first thing which we did with the organization is that we set up what we called a follow-up and monitoring system. There was this regional mechanism with laboratories, which we may say were to serve as a bulwark against the expansion of this pandemic. And we set up an air link to ensure that the products were carried to countries which faced risk. For instance, countries at war and remote areas like in Mali or in Sudan. And
nous avons mis en place une plateforme technique de réponse. Donc, on a mis en place ce qu'on appelle un système d'achat de banalisateurs, des équipements qui prennent en charge banalisent pour faire
we have a recycling method so that the products are not toxic for patients anymore. So whether they are funding with the IMF, the World Bank, and so on, Now, when it comes to a recommendation, because I don't have a lot of time, I just wanted to say that before talking about recommendation, if we look at products that we use ourselves, 100% of if China is in lockdown and then they cannot manufacture, we do not have any more paracetamol, for example. And in its plan made in China, China will become the first exporting country. However, today we see when it comes to strategic change where Europe is trying to relocate its pharmaceutical production, countries have gathered to try and create a market to distribute medicine and drugs. Now the question is, what about Africa, where 90% of the medicine we consume is imported? We are in a strategy of economic war. And as I was saying already, there has been a sort of so it's important that we put into place a production unit. We have to remember that it is a finite project. If you do not have excellent centers that produce the raw material and everything, we have the equipment, but we'll never be able to be autonomous. And when it comes to pharmaceuticals, so what I really recommend myself, and I don't think I am the only one, since we work as a thematic group financed by the World Bank that look at independent pharmaceutical strategies, what can we do so that the patient can have access to medicine with less than $1 per day? What we want is excellence pool, meaning that a country has capacity to fabricate raw materials, another country that has the capacity to have the equipment, another one that can transfer technology, because if you have the equipment, you have conditioning tools, and you also have the raw material, but you don't have the equipment, then you'll still be dependent. So we want to really get rid of all the point where we'll still be dependent. So we need together to have all the levers that will allow us to be autonomous, to be able to manufacture some drugs and medicine. It's been seen in some countries, they've had been manufacturing unit, and we thought about the final product, but not of all the levers I've just mentioned. And after 2-3 years, because the plant was dependent on raw material and equipment, it's a problem. So we want excellence pool at the level of our country, of French-speaking countries. Will maybe a technology transfer with North Africa. And to end my speech, if we are no longer dependent, if we have a raw material excellence pool, a raw material equipment pool excellence, a raw material and now human resources pool excellence pool as well, and if we have all of this, we'll be able to unite all the conditions to be able to have the condition to manufacture our own medicine and drugs. I'm trying to be brief, but what is important here is this notion of independence, pharmaceutical independence, using all the levers I've just cited. Thank you. We would like to thank you, Dr. Ba. The actions of your centers, and the recommendation that you've formulated. I would like to introduce now the Dr. Annette Sendiaye, Director of the National Pharmacy of Supply in Senegal. First of all, I would like to congratulate her for the work that she's been doing. You've put into place strategies for a pharmaceutical supply that has had a great success. However, you've had some difficulties to get supplies and to be able to manage the donation with this pandemic of COVID-19. Can you explain to us your strategy when it comes to supply, and especially in this crisis?
Merci, Monsieur le Secrétaire Général.
Thank you, Secretary General, for giving me the floor. Mr. Mbang, I would like to first of all commend the co-chair, and I would like to say that I followed Dr. Ba, with whom we've been working quite a lot on these questions. My experience as the national pharmacy for supply, the COVID has really highlighted the weaknesses of our supply chain. First of all, an imbalance with the fact that once again Africa depend on importation, apart from North Africa. Now, there is no collaboration between Sub-Saharan Africa and Northern African countries that are way ahead of us in a way, with an importation almost turned there towards Asia and Europe. And there is another observation that was made, as it was said, this relocation of some sectors of pharmaceutical industry towards Asia. That highlights giants with clay feet that showed straight away their weaknesses from the onset of COVID-19 and the closing of borders. Now, also, another observation when it comes to the supply chain, very complicated supply chain that are fragmented with manufacturing site on one continent, quality control on another continent, and distributors in another. There is also the weakness, the poor production capacity of main site in Africa, where we have two manufacturers, South Africa and Tanzania. And as it was said by Dr. Ba, these multinationals in Europe import more than 80% of their raw materials, and they realize that their production capacity has decreased quite a lot. This crisis, Mr. President, was brutal, with a propagation of a rapid propagation of the virus, a reduction of mobility, a decrease of importation, and as was said by the co-chair, Professor PIOT, restrictive measures. People wanted the same product at the same time, and therefore they all locked themselves. Europe locked herself in. China, same. India as well has taken some restrictive measures, but as we know, it was still importing its raw material to China. So Africa, in a way, was alone, facing its destiny, and I believe that even in the darkest of hours, there is still light, because the shortcut in supplies has highlighted the resilience of our health systems and of our supply chains in Africa. The increase of consumption is a sudden change in the functioning of supply chain to be able to organize ourselves. And the secret of resilience here was those safety stocks that were already in place in Senegal. It's been one of our strengths, and this capacity as well to try and have exchange in Africa. And I'll come back to the difficulties on this. In the whole world, another lesson was the change in prices. We talked about businesses. We weren't talking about health anymore, public health. We went from 1,300 CFA franc for mask to 25,000 with so many middlemen and an increase of prices. And as Dr. Bass said, in counterfeit appearing for diseases, but also for PPE. With an unbalance and a risk of having lower quality products. And so a particular attention to be put on Africa so that we wouldn't be the dumpster. The challenges were many. We needed access to all the countries, but we also need approaches, innovative approaches for a coherent supply with a more and more unstable market. We also had to strengthen this dynamic, this integration dynamic for local production, because at a certain point, and especially at the regional and sub-regional level, we realized that we had capacities, yes, but we still had some capacities. However, distribution channels were so weak and infrastructure same that, as an example, I can say, for example, that to bring products from Mali, we needed a week even by road. So here as well, those are challenges we've been facing. And I believe that those are lessons to be learned. We talked about pharmacopoeia and traditional medicine. We've seen that in countries, products and traditional medicine were used, and now they are not being questioned anymore. However, distribution channels were absent, and all the initiatives were local and weren't distributed in the different distribution, the large-scale distribution channel, and this is also a lesson to be learned. The national authorities have been overwhelmed because they had to change the different supply chain channels, as well as changing suppliers, asking for approval when it came to imports, and it was really difficult. And there as well, there have been some challenges. Another challenge has been quality control. You know that in Africa we do not have a lot of in our centers. We had some difficulties given the shortcomings of some products. Storing capacity have been problematic, as well as the President Benga said. There's been so many donations, which led to coordination problem. These donations weren't done by taking into account the needs of the countries, but standardized were and they haven't been able to take into account the individual needs of each country. As perspective, Africa has to put into place a more assertive leadership and coordinated intervention of all actors, a political will, a strong political will, but also a commitment of all countries to be able to really elaborate investment plan, but also to be able to mobilize funds. We need to go through concerted approaches so that we can make the national supply system more sustainable, that together we work with local production capacity, that countries do not do the same, but that countries can work together in community areas and that they can work together and that we have a manufacturing unit that are feasible, that the areas in Africa are more dynamic and that the exchange areas in Africa are more dynamic, and then we can promote the trade in inter-African region. A priority to development research as well, so that we can highlight our traditional medicine, the use of plants, and also the setting up of infrastructure, road infrastructure, airports that can be useful to facilitate exchanges. We cannot go to Rwanda, go through many countries, and therefore have 15 to 20 days delays to trade products between countries. We also need to leverage and take advantage of the digital revolution and improve the access to the internet. COVID-19 has showed us that we needed the internet, a stable internet connection. Exchanges, discussion were virtual, and it was therefore paramount for the rapid actions to be taken. And I would like to finish on saying that Africa should today show its the secrets of its resilience, the strength of its health system and of its supply chain, to ensure that we can ensure these changes and structural transformation, so that we can have sovereignty in the pharmaceutical sector, to seize the many opportunities to take advantage of innovation, but also the emergence of new talents. COVID-19 has showed that we were able by ourselves, for ourselves, to do a certain amount of things, ventilators, masks, and so on and so forth, and therefore having a equitable and sustainable Africa. I would like to say that another Africa is possible. It's not only a utopia. History is looking at us. Thank you for your attention. Thank you very much, Mr. Ndiaye. Another Africa is possible. I like what you just said, your last message to everyone. And I think that it is already done. As a last speaker, the last but not least, that is Ted from Morocco, the Professor Mohamed Khaled Chouli, that is at the head of the Department of Preclinical Sciences and manager of large social organization in Morocco. Morocco ensures 60% of the drugs needs of its population at the moment, and this is quite unique. Can you share with us strategies and challenges of an effective supply chain, and especially in the context of the COVID-19? You have the floor. Thank you very much, Mr. President. Can you all hear me correctly? Yes, yes, we can hear you perfectly. No, I can't see your screen being shared. I'll just share it in a minute, please. Thank you. Yes, it's working now. Thank you. Can you see that? Yeah, thank you. Thank you to my friend Ibrahima that has associated me to this very extraordinary forum. And it is with the organization. I know it's not really easy. You know, with this digital use, but also I think that the speakers are of such quality that I would like to thank the organizer. It's really a success, and it's always a pleasure for me to be here. After Marrakesh, Dakar is my second city of choice, and it's always a great pleasure to participate with my friend of Dakar. I've heard the contribution of the Dr. Annette Sek, and I agree with her. Another Africa is indeed possible. And as a professor at the Medical School of Marrakesh, but as well the president of YENDA, an NGO that regroup all the students in medicine and pharmacy throughout Morocco. We have a human capital that is absolutely extraordinary and that should change things in Africa and make of our continent a continent of possibilities. You are right through the contribution of Dr. Alassane and of Dr. Annette. Yes, indeed, the difficulties are huge when it comes to our supply chain, and through globalization, the crisis has shown once again that we have difficulties because the world is interconnected, of course, and so supply chains are linked, interlinked. We've given examples, whether through the very simple example of paracetamol in China and other example as well. So today our continent is suffering, whether with reagent or some drugs. Our continent is suffering, and the crisis has shown it with the closing of borders, national borders, that COVID has created a big disturbance unprecedented that has impacted the supply chains in this period. But at the same time, this crisis for myself, is an opportunity to really look at our governance model on our continent. And you're right, Dr. Anna, to say that coordination today, leadership coordination today in Africa, has really to look back at governance and on many aspects, not only for the medicine and drugs, but also for food in general. You are completely right. We need to look back at it. We are hearing this, facing this, whether biomedical material. You've given concrete examples. I will not come back to those. And to your diagnostic. And I think this asks the fundamental question of national sovereignty when it comes to international health problem issues. And it's not a new question. I think that a lot of international thinkers, and you have Mark Sankal, in 1961 had already touched upon it, the question of national sovereignty. And I think this is a big problem, a huge problem, and unfortunately we are still not able, and it is high time through this crisis that shows us our weaknesses, that coordination, collaboration, inter-African collaboration takes things more seriously. We have a human potential that is absolutely extraordinary through researchers, students, and we do not have to envy anyone. Countries where crises were more important, where African resilience was absolutely extraordinary, and I think that it is high time that we start really taking this question seriously, or more seriously, whether it is about food security, health security, or even the security after technical and there have been things that have been shown through traditional medicine, the use of plants. We need really in Africa to be careful to look at this triangle of food security and of the information, technical, medical information of our really heritage that will allow us to really look at this question of sovereignty in general. Really quickly to give you an example of how Morocco reacted. As you all know, today I would like to give you some statistics. We are one of the countries in Africa, in Northern Africa at least, that has been really affected. We have had 388,000 cases with more than 6,427 deaths today. I would say that many doctors have perished, unfortunately, nurses as well, that died during this pandemic since March. Morocco has really had issues with this pandemic. Very important number of cases that we've been dealing with great resilience and determination. And I would like to cite three faces. Excuse me, Professor. The session will be cut short in 2 minutes because there will be another session. Unfortunately, I'm the last one. Well, very quickly on masks. The Moroccan industry was able to readapt completely to produce our own mask in Morocco. And I don't know if you remember the world mask crisis around the month of March, April, and May. Quite quickly, the Moroccan industry was able to really adapt and to produce our own mask. And today we are able to produce millions and millions of masks, and Morocco exports masks, which was very important when it comes to anticipating the crisis. As a second phase, we adopted really quickly, thanks to a national committee, when it comes to chloroquine. We decided rapidly to use it. And honestly, this anticipation when it comes to its use, and first of all, it was available in our stocks at the central pharmacy, and it was locally producible. And so it was a very important strategic decision that allowed us to really well manage the crisis for when it comes to the drugs used. And the third phase, as you know, Morocco has once again anticipated, and this week we've started to use vaccine, and now they've decided to use the Chinese vaccine that we've imported. And this very week, Morocco has started vaccinating against the virus with the Chinese vaccine, a decision that was very important to try and, break the propagation chain of the epidemic. That was very important in Morocco. If I have a message, and it's a pity because we do not have much time, but if I have a message as a professor, a university professor, I would say that our countries in Africa more than ever need to face scientific and technical world challenge. We have a human capital that is absolutely extraordinary, whether the students in the institute, in schools, our experts, our teachers, this human capital, extraordinary human capital, our decision makers need to believe in it, so that we can really lead. This can lead to sovereignty, not only for drug, but on other aspects, on our development in general. We should work together through more collaboration so that this African continent can be a possible Africa. Thank you.
Pour qu'on puisse justement affronter cette question de la souveraineté, donc pas en termes uniquement, je veux dire, de médicaments, mais sur plusieurs aspects qui touchent notre développement de manière générale. Et je crois que nous avons intérêt à travailler ensemble, plus de coordination, plus de collaboration pour justement faire de ce continent africain vraiment une Afrique possible. Et merci.
Merci. Merci beaucoup,